every profession, errors are made. The cook puts too much salt in the soup, or the dry cleaners has ruined your favorite outfit. But when a physician makes a mistake, it could change your life forever. According to the Institute of Medicine report, medical errors have become the 8th leading cause of death in the United States. It has bypassed breast cancer, auto accidents, and AIDS. But still, errors made by a physician or other medical staff are still not talked about, or at least until now. The people you are about to meet are real people. They are not actors. These are real stories. What these survivors have in common is that they want their story told. They want others to learn from what has happened to them, and they want changes made. Nance and Bob are a young couple from Merrick, New York. Only a year after a stillborn birth, Nance was diagnosed with an ectopic pregnancy.
Okay, my name is Nance. I had an experience a couple of years ago where I was very severely ill, and despite repeated calls to my physician, she refused to see me. I kept calling, she kept refusing to see me, and I was very, very sick, and I feel if I didn't just pick myself up and get somebody to drive me to the hospital, I definitely would have died. There was also a lot of covering up going on between the doctors lying about what happened. I was in a lot of pain, and I could barely walk. I was in agony, and the doctor just refused to see me, and after calling her several times, I called another doctor from another medical center to see me. And apparently I was pretty bad off by the time I got to the hospital. And I think I'm here because people have to understand that a doctor's word is definitely not the last word. If you feel there's something wrong, you have to be willing to fight for yourself. If I had been a little more assertive, I might have gotten to the hospital sooner, and maybe I wouldn't have the permanent damage that I have now.
Okay, my name is Leonard, and I took my wife to the hospital July 24th to have her baby, and basically she was killed by an unsupervised resident at the hospital. It's kind of hard for me to talk about it without getting emotional. The resident came into the room and basically tried to give my wife an epidural. She didn't have any consent. No one asked her to do it. The attending anesthesiologist basically told her, go ahead, do it. And my wife died as a result of the resident panicking, basically. She panicked, and she forgot she gave my wife this fatal dose of medication. She kept my wife on her back all along while she tried to cover up her error. And then I got the results of the State of New York Department of Health investigation as to what happened to my wife. And the conclusion basically is that my wife did not get any proper care, or her care was far below the normal standards at any hospital. And the nursing care was poor. The resident, basically, what she did to my wife was, in my own words, basically that was a killing. Why? Because at first my wife was talking to her. I have a headache. And that is where the nurse was cited, because at that time she should have called the attendant. She didn't do that. Then my wife said, I'm numb all over. And no attendant was called. They tried to fix the problem themselves. And in so doing, she did a lot of things which were basically inappropriate. The error happened initially. That's understandable. We all make errors. But what happened after the error happened, in my opinion, was basically criminal. what I've learned from that experience was that you really can't trust someone walking into the room and says, I'm Dr. So-and-so. You have no idea who that person is. You have no idea where that person trained or how far that person has trained. A motorist basically brings his car into a mechanic for a tune-up. If something goes wrong, he could reverse it or correct it. But when you're dealing with a human being, when you're dealing with a life or someone there, you have to be very careful. You can't just be God. You can't play God with someone's life. You can't try to prove yourself, like she said. And the resident said basically, I was in a hurry, you know. And she didn't follow any proper procedures. And as a result, I lost my wife. You got to question doctors a lot. You got to be talking a lot. You got to ask them about their years of service in the field that they're in.
What these people all have in common is that medical error has changed their life forever. They all want to be part of the solution of making healthcare a safer profession. Nance and Bob now only want an apology and physicians to be more sensitive to the patient's emotional needs. Leonard wants resident physicians to wear noticeable name tags so patients know that they are still in training. They want to make sure it doesn't happen again. And somewhere, someplace, someone will listen. Because it could happen to you.
I need comfort.